A special thank you to each of our subscribers who make this channel possible. Here's today's story. In a fiery segment on CNN NewsNight, senior political commentator Scott Jennings faced off against liberal host Abby Phillip and a panel of progressive voices regarding the controversial nomination of Robert F. Kennedy Jr. as the head of the Department of Health and Human Services, HHS. The discussion quickly escalated into a heated debate about public trust in health agencies, the efficacy of COVID-19 mandates, and the qualifications of Kennedy for the role. Jennings opened the segment by questioning the rationale behind opposing Kennedy's nomination, sparking a flurry of responses from fellow panelists. Georgia Republican-turned-Democrat Jeff Duncan argued that Kennedy lacks the managerial experience necessary for the position, to which Jennings countered by pointing out the lack of experience in previous HHS secretaries. He highlighted that the current administration's HHS Secretary Xavier Becerra has a background in law and politics, while previous secretaries under Obama had their own questionable credentials. The conversation then shifted to the contentious topic of vaccinations and their alleged connection to autism, with Jennings emphasizing that the real issue at hand is the declining public trust in health agencies. He asserted that this skepticism stems from the heavy-handed mandates imposed during the pandemic, which many believe were ineffective and poorly communicated. Former CNN personality John Avlon attempted to steer the blame for the COVID-19 death toll towards Kennedy and Trump, but Jennings stood firm, arguing that the public's distrust was a direct result of the government's handling of the pandemic. He stated, "This country was drugged through a bunch of condescending and heavy-handed mandates that all turned out to be garbage." Phillip, trying to regain control of the narrative, brought in Drive W. Ian Lipkin from Columbia University, who insisted that public health agencies like the CDC and NIH are invaluable. Lipkin acknowledged that while the vaccines were not as effective in preventing transmission as initially hoped, they still played a crucial role in reducing severe illness and mortality. Jennings, however, maintained that the agencies need reform to restore public trust, rather than a complete overhaul. The debate highlighted a fundamental divide in perspectives on public health and the role of government during crises. As Jennings argued for the importance of questioning public health policies, Phillip accused him of fostering distrust akin to election denialism. This exchange underscored the contentious atmosphere surrounding the conversation about health, trust, and accountability in leadership. As the discussion progressed, Jennings reiterated his support for vaccines while acknowledging the legitimate concerns that many Americans have regarding public health policies. He stated, "The doubts in the public health regime in this country were not made up out of whole cloth." The segment concluded with Jennings challenging Duncan on the qualifications of the current HHS secretary, prompting a humorous yet pointed response about the state of political discourse. The ongoing debate about Kennedy's nomination and the broader issues of public health trust will likely remain a hot topic as the Biden administration navigates the challenges ahead. That's all for this story. We upload videos every day covering many different subjects, so hit that subscribe button to stay informed. Thanks for watching.